Hi, I'm Jen Rubin, editor-in-chief of the Contrarian. I'm delighted to welcome back to our Contrarian subscribers and others, Cynthia Miller-Idriss, who you all know as an authority on right-wing violent extremism. And she brings with her the new director of the program that she is famous for, the acronym being PERIL, Bill Braniff. Bill, welcome. Nice to see you.
Thank you so much. Happy to be here.
We're delighted to have you. So let's start with some basics. The entity that you head, the research facility that you head, has the acronym PERIL. What does that stand for? And what is it that you study exactly?
Yeah, so the lab is called the Polarization and Extremism Research and Innovation Lab, known as PERIL. We also have field staff who we call care staff. So that's the flip side of the PERIL side, is care in communities, community advisory, resource and education teams who deliver some of the tools that we create. But in the lab, we create empirically tested, evidence-based tools that provide communities with ways to be more informed about and then recognize, reject, and help others who are persuaded by harmful content online and offline. So conspiracy theories, propaganda, supremacist ideas, and more.
Now, there's a whole range of ideas out there. Some people refer to Christian nationalism or right-wing extremism or violent extremism. How do you define the thing that you are studying and trying to combat?
Yeah, that's a great question. It's a constantly moving target. We talk about this all the time. What are the best words to also reach the broadest number of people? I tend to think about this as harms, as harmful content broadly writ large. And then within that, there's a big range. So, hateful content is part of that, of course, and in a large part, hate-fueled violence, but also conspiracy theories that are not necessarily motivated by hate, but can cause big public health problems like anti-vaccine content. We also have anti-government harmful mobilization around a coming idea of a civil war. So there's sometimes violent environmental movements, violent climate change movements that can mobilize and have in the past on the left mobilized into violence. And then there's the international range of harms from Islamist and other kinds of international terrorist movements that also have recruited Americans into harmful ideologies.
So, Bill, we're not talking about just on the right. Tell us a little bit about kind of the ideological range.
Correct, right. There's a really brilliant scholar named J.M. Berger who defines extremism as the idea that in order for my group to be okay, it's necessary for us to harm the other group. And that's a really simple but eloquent way to kind of understand that can manifest in all sorts of ideological ways, right? Just the idea of othering another group, in groups and out groups, it kind of makes this a little bit more tractable, I think. It's also, though, I think important to really understand that people don't start with that end state, right? There's often underlying risk factors in that person's lives, or maybe an absence of protective factors in their lives. And so a lot of what PERIL does is really try to get ahead of that manifestation, whatever that manifestation might be, right? It might manifest as hate, it might manifest as grievance, it might manifest as ideology. But how do we get in front of that and address underlying risk and protective factors so that we never have to worry about that manifestation?
And I think that's what's unique about PERIL, and I do want to get to that. Let's start with kind of a geographic question. Is this a U.S. problem or is this a worldwide problem?
So the problem of harmful violent content harmful content that it mobilizes violence against outgroups, that's global. And in fact, the vast majority of terrorist activity is outside of the US, outside of the West. Within Western countries, so Western Europe, North America, Australia, New Zealand, what we think of as the far right, so supremacist kinds of ideas and also anti-government ideas, have been the biggest problem in recent years, either the biggest or the fastest growing problem. But in the 70s and 80s, that was political violence from the left, right? When we had the Weather Underground and other kinds of bombings coming from the far left. So these things can change, and they also can create kind of hybrid forms. But it's definitely a global problem with global circulation, especially online, with copycat tactics, and sometimes egging on globally or copying each other's terrorist attacks, as we saw with, terrorist attacks in Norway, and then Christchurch, New Zealand, and then El Paso and Pittsburgh, things that really echoed the same type of conspiracy theories as motivation.
Bill raised a great point that people don't start there, that they have certain risk factors. Talk to us a little bit about what those risk factors are. Who are the people who are likely to fall in with violent extremism?
Well, it's really important to underscore that there are risk factors in all of our lives, right? We're all in some ways vulnerable at some moments to the siren song of the promise for certainty, or the promise for empowerment, or the promise for significance, the promise for revenge, right? So in no way is the work of prevention intended to be predictive based on individual level circumstances. We don't go to our primary care physician because we're predicting a very specific negative health outcome 30 years from now. We go to a primary care physician because we can all improve our general health and wellness and decrease the likelihood of bad things down the road. And that's really important. This is not about prediction, it's about prevention. In terms of risk factors that seem to really matter, having a criminal record is a really significant risk factor for violent outcomes. It's not because individuals who engage in crime have some sort of ideological bent. It's that creates real obstacles in one's life to upward social mobility. Adverse childhood experiences can create vulnerabilities that can later manifest in negative ways. But these are by and large not, very specific or very unique to any one individual, such that we can create a profile. And that's certainly not what prevention is intended to do.
Cynthia, a lot of what we think of the people who are attracted has to do with alienation, resentment, those kinds of emotions. Talk to us a little bit about that, and whether that sense has gotten worse in a very technologically sophisticated, changing society with religion, technology, economics all changing, whether that sense of alienation, resentment, isolation is growing and therefore increasing perhaps the number of targets who would be attracted to something like this.
Yeah, I think, one of the things we have to really look at are patterns of isolation, alienation, and mental health concerns that come from that, meaning not everyone who has mental health concerns or is isolated or alienated turns to extremist content, but it creates a vulnerability to persuasion by narratives and propaganda that tells you someone else is to blame for the state, right? There's some scapegoating that goes on, or fear mongering. And that's particularly true right now, it's worth saying, for men and young boys who men make up the vast majority of violent actors, of mass shooters, of terrorist actors, although women's roles have been increasing. And men are more isolated. Those outcomes are worse for men. They have 3/4 of the deaths of despair in the US, which are suicides, overdoses, and deaths from alcohol. 50% of men in the US say their online lives are more rewarding than their offline lives. And 25% of men under 30 say they don't have a single friend. So we have a real crisis of loneliness, a crisis of isolation among boys and young men that is real, and those grievances are real. What I often say is there's no explanation for why a crisis of boys and men should have resulted in a crisis of misogyny, as we are seeing, or of violent extremism mobilization. But that is a pattern that's there. And part of what explains that is what happens in online communities with explanations that are offered for the plight. Instead of searching for structural solutions or more resources or help, it's easy in a way to blame and scapegoat others, whether those are religious and ethnic minorities, Jews or immigrants or feminists who are somehow responsible for this plight, and then be invited into a solution that gives you a sense of purpose and meaning and a contribution to something bigger and better than yourself. And so it's not just negative things that are happening, it's often a positive quest for something more significant than you that brings you into a brotherhood of others. And that can really give people a sense of meaning. And that's something where we failed in society if we haven't offered that to them earlier.
And I guess there's two sides to this. One is the supply, and the other is the demand side. With the supply side, because of social media, all kinds of technology, the opportunity to project these ideologies and to reach alienated young people has obviously increased. Have we seen the correlation between social media use, social media addiction, and the rise of these violent extremist groups?
So there's some really important data that comes out of the University of Maryland's START Center. And full disclosure, I used to serve there as the director, and before that, the number two. And they've demonstrated a correlation between increase in social media usage or online livelihood and a decrease in radicalization timelines, meaning the point of time where someone is exposed to an idea and then eventually tries to take action to engage in violence or criminality to advance that idea. There's been a massive increase in mass casualty attacks in the United States since the early 1990s, on the order of 2,000%. There has been a recent data set that unfortunately was just shuttered by the Department of Homeland Security, also produced by START, that documents nearly 3 targeted violence or terrorism plots per day in the United States currently. And that is astonishing and concerning data.
And has been an increase.
Right? And is increasing.
So one of the questions that always gets asked is, what is the correlation between political actors who may not be advocating violence per se, but fuel some of the themes, the othering, the blaming, the resentment? Is that a correlation with the rise of these groups, or is that an open question?
Well, I think that it's a complicated question. So one of the things we see is that the biggest spike in hate groups in recent history actually came right after President Obama was elected. So there's a kind of backlash effect happening there. And that's some of what we're seeing right now as well, with anti-feminist conspiracy theories and anti-LGBTQ kind of mobilization. So it's not always that you're seeing a legitimation, although sometimes it's also because there's a legitimation. But I think the broader climate is when you have rhetoric that is painting the other as dangerous, as threatening, as existentially threatening even, using language like replacement, sometimes that echoes conspiracy theories about some sort of puppet masters organizing a replacement of white civilization, let's say. Those kinds of words can legitimize, normalize, and kind of desensitize people sometimes to what are often dehumanizing types of descriptions of other people, of immigrants, of describing them as rapists or as living in deplorable conditions in Baltimore, or whatever the descriptions have been. So I think the thing I worry about most is the normalization, the legitimation, and the dehumanization that comes from that kind of constant rhetoric. But the data patterns are more complicated because it also is caught up in backlash to progressive movements.
Interesting.
Maybe to say it really, really succinctly, we'd be naive to think that culture doesn't shape behaviors. And that includes our political culture, but it's not unique to our political culture. There are multiple forces at play, but certainly culture matters. And any interventions meant to minimize harm should take that into account.
Well, it is an adage that culture is upstream from politics, and that seems to be the case here. So in the past, this issue has been addressed as a national security problem or a policing problem. We have to find out who these people are and either stop them or round them up and punish them after the fact. That, of course, has reduced potential attacks, but it hasn't really gotten to the problem. You have a different approach, a different model for how you address this issue. Talk to us a little bit about, my words, not yours, sort of a holistic approach that targets many different aspects of the problem, hoping to reduce the phenomenon.
Yeah, this is, it's a very exciting week for us here in Peril because Bill has just joined us from coming over from CP3, the Center for Prevention Programs and Partnerships in the Department of Homeland Security, which in its, so in So I think there's something to be said there that's unique in the sense that in a way that is a security agency, but Bill has been, I think, along with me, we have been two of the biggest advocates of what we call a public health approach, which is a very upstream preventative model that takes a holistic idea of all of communities needing to be involved in a much earlier level of prevention. So you think of this as what we have typically done in the US is put all of our efforts or most of our efforts into trying to stop an already radicalized actor from becoming mobilized to violence. Like, how do you stop someone who already has hateful ideas or radicalized ideas from picking up a gun and taking action? And that's really a build better barriers approach, and that's been important. Like, those types of preventative measures have definitely saved lives. Teaching synagogues to lock the doors before service, teaching hostage mitigation, crisis techniques to get out of a situation have worked, but they don't actually stop the problem from getting any bigger, and they don't off-ramp in an earlier way. They just invest a lot in the treatment of the disease rather than the prevention of it. So, if you think about the public health metaphor, it's, we don't just treat cardiac disease and diabetes once it manifests. We invest in communities' education about healthier eating and exercise habits, and we make sure ideally that there's not food deserts or that there's safe walking trails so that people can make choices. I think where it's been difficult for the US is worrying that infringes on free speech. And I think one of the really important things to emphasize here is that equipping communities with tools to make more informed choices about the content they consume or the manipulative tactics of bad actors does not infringe on their choice to still go down those pathways. It just equips them with tools to be more informed and be more skeptical and keep their families safer. And so that's, I think, what's unique and different about our approach.
Yeah, I think it's really important to understand that if we only take an individual punitive approach, right, a criminal justice sort of security-led approach, we're really limiting ourselves to we have one point of intervention, the individual, and at one point in time when they're mobilizing to violence. And man, that is a narrow window, right? But if we think about the lessons from violence prevention for other forms of violence from the fields of public health, right, we've been studying violence prevention for over 3 decades in the public health community. Things like suicide prevention, intimate partner violence prevention, violence against children. Well, we can really broaden the time horizon for potential interventions and increase the number of levels of intervention, right? Individual, family, friend, community, societal norms, right? And now we've got this wide aperture of opportunities and this longer timeline to actually do the kinds of interventions that result in less risk down the road.
And I think that's important for people to understand. You're not rolling out a plan for the federal government to mandate all this kind of training and intervention. The federal government, as I understand your approach, has a role, but so do communities, so do civic groups, so do families, so do teachers, so do individuals, frankly. So what we're going to explore over the weeks with you folks is the whole range of interventions and how that works. But as we reach the end of our first time with you and Contrarian readers and viewers, we're going to have lots more because I find this a fascinating, essential topic. I just want to ask kind of a global question about your research. Human beings don't have necessarily control groups. So how, as you are looking at federal, state, local, personal interventions, how do you know if things are working? What is the metric by which you judge your research?
I think that's one of the things that's the most unique about PERIL, and part of our of what we really strongly advocate for in the field is testing and understanding what is effective. So we do a lot of work with parents, with teachers, with mental health counselors, coaches, faith leaders at the community level, for example. And every tool that we create, whether it's a PDF downloadable or a video or a training, we have pre and post tests to see, did it improve their knowledge of the problem? Did it improve their confidence that they're able to intervene effectively with a young person, let's say, who's been exposed to harmful online content? Does it improve their willingness to do so? And do they know how to get more help? Those are really the sort of 4 things that we really know have an impact. when we're looking at direct interventions in the digital media literacy space, like with short form video, we have comparison control groups, we call them, where we actually study this before we release the video. So people will watch a short video of someone learning how to build a birdhouse, or they'll watch our video intended to reduce anti-Semitism. And then we can really, with statistical analysis, determine the effectiveness of our video. That's really important, and we'll talk about that in the coming weeks, I'm sure, because sometimes interventions can backfire, and we don't want to release anything to the public that could possibly make things worse. So we are really committed to testing and providing evidence to the public about what's been effective.
I think that is a fascinating approach, and I hope our contrarian readers and viewers can understand why we have decided to elevate this. Perhaps we could be a small part of the solution. And we thank you, Bill. Congratulations on your new spot. And Cynthia, it's always great to have you. And we will look forward over the weeks to learning more about the program, what works, what doesn't work, your community activities. So thank you for sharing all of your knowledge and insight with us. And we'll see you again soon.
Thanks, Jen. Look forward to talking next time.